Hi, today's lesson is on ketamine treatment and what does ketamine do to the brain. Before I start to address how ketamine works on the brain, I want to take the time to explain just what ketamine is because people have the wrong impression about it. They have a lot of misinformation about it. And so I'm going to give you a brief overview of the ketamine story so you can understand what's occurring with this new amazing breakthrough in mental health. The FDA approved ketamine as an effective general anesthetic medicine in the 1960s. It was used as surgical anesthesia to treat injured soldiers on battlefields during the Vietnam War. With its pain-relieving properties already known, the use of ketamine has become a vital tool for clinicians to manage battlefield injuries and severe pain outside clinical settings. It has saved thousands of our soldiers' lives. Its sedative and amnesic effects allow it to provide pain relief without negatively affecting airway reflexes or cardiovascular functions. It did not cause lower blood pressure on the battlefield as other drugs that had been previously used. Recent studies have shown that this medication can act as an effective preventative measure against opioid hyperalgia. That's just a big term. Hyperalgia is a term meaning an increased pain response or an increased sensitivity to pain. Surprisingly, it can result from either an injury to the body part or, and this is the surprise, from use of opioid painkillers. Yep, the higher the dose of pain medications you take, the more sensitive to pain you become. So a person becomes more sensitive to pain as a result of taking opioid medication. This is called opioid-induced hyperalgia, or OIH. And due to the increase in opioid usage in the country and those with so much chronic pain, I know because I'm one of them, OIH is becoming more of a concern. Something that typically wouldn't cause pain will often feel painful to somebody with hyperalgia. Things that are generally painful will feel significantly more so for someone with OIH. Ketamine is invaluable for addressing conditions that require the use of opioids. So the cycle of pain, needing more pain medications to relieve that pain, is a cycle. Pain meds make you more sensitive to pain, and ketamine breaks that cycle or prevents that cycle from occurring. A condition of hyperalgia would be chronic regional pain syndrome or RSD, which is reflex sympathetic dystrophy, which I'm going to discuss later in this lesson. So let's talk about how ketamine anesthesia has led to the biggest discovery for treatment-resistant depression, suicide ideation, and pain management in decades. This is breakthrough information here. Ketamine affects the brain differently from traditional antidepressants. I want to now talk about the emergency responders' use of ketamine. Emergency responders began using ketamine hydrochloride for agitated patients, including those that were attempting suicide. It was the use of ketamine in the emergency department that healthcare professionals began to realize its powerful effects against depression and acute suicidal ideation. First responders were finding that patients with acute suicidal ideation were denying they even had suicidal thoughts after receiving a ketamine treatment for acute pain management for their suicide attempt. Ketamine hydrochloride is called a dissociative anesthetic. It is known for creating a dissociative experience, or what most people would call a trip, which led to ketamine being labeled in the long list of illicit drugs or as club drugs, one of the club drugs. Ketamine is known for its diverse and multi-level effect on the brain. The effects of ketamine have been studied extensively within the realm of human neuroscience. Researchers have found that it can act as a powerful brain stimulator, helping to improve brain function in areas such as memory, decision-making, and learning. This has made ketamine increasingly attractive to researchers looking to develop treatments for brain-related issues such as stroke or head injuries or brain injuries. So let's talk about how ketamine may work on the brain and how it has become one of the biggest breakthrough medications in mental health in decades. I'm going to include pain management in this as well, because ketamine hydrochloride is providing relief from devastating and unrelenting chronic pain conditions like chronic regional pain syndrome, CRPS, or it's also known as RSD, or reflex sympathetic dystrophy, as I mentioned earlier. Understanding how it works requires delving into both neurotransmitter changes as well as the regions of the brain impacted by ketamine use. Don't worry, I'm going to break how ketamine works into bite-sized pieces for you and put it in understandable terms for those not in the medical field. Ketamine is an interesting drug due to its effects it has on the brain activity. It appears to stimulate brain-derived neurotrophic factor, BDNF. It is a protein involved in learning and memory, as well as it's responsible for helping promote brain plasticity. This means that ketamine may have a positive effect on brain function and can be useful in treating depression, post-traumatic stress disorder, bipolar disorder, and more. It's important to note here the therapeutic effects, and that's the key here, therapeutic effects of ketamine are due to changes it creates in your brain. Different neurotransmitters and regions within the brain respond differently. A neurotransmitter is a chemical substance in the brain. They are the chemical messengers that help nerve cells or neurons communicate with each other. There are many different types of neurotransmitters. They include serotonin, dopamine, glutamate, and acetylcholine. Neurotransmitters serve several functions in our brain. They regulate our appetite, our sleep-wake cycle, and our moods. Now let's talk about neurotransmitters, glutamate and GABA, G-A-B-A, which is gamma aminobutyric acid. I'm probably not saying those right, but it's close enough. Glutamate is an excitatory transmitter. GABA, G-A-B-A, on the other hand, is an inhibitory neurotransmitter. So if the brain was a car, glutamate would be the gas pedal chemical. It makes things go. And GABA is the braking system of the central nervous system. Glutamate and GABA, when they work together, they are symptoms making the brain function as a finely tuned car. This allows for balanced messaging between neurons. Ketamine has been found to help restore this balance when it's disrupted due to conditions such as high anxiety, mood changes, or dependence on depressants like alcohol or opioids. Additionally, ketamine can directly impact glutamate levels, which have critical implications in areas like major depressive disorder, MD, and in the treatment of acute suicidal ideation. Recent animal studies conducted by Yale researchers have revealed incredible findings on the effects of ketamine and its influence on the synapses in the prefrontal cortex, a region known to shrink due to depression. Amazingly, only 2 hours after administering a single dose of ketamine has resulted in an increase in both the number and function of those key neural connections. That's amazing. Ketamine produces feelings consistent with previous research that demonstrated how effective this substance can be for rapidly treating symptoms associated with depressive disorders. Think of the depressed brain looking like a forest in winter. The trees and branches are bare. Then think of ketamine as springtime for the brain. A dose of ketamine causes the brain to reconnect broken synapses. Think of how the trees come to life in the spring. The leaves and branches come alive. That is the effect of ketamine on the brain of a depressed person. Oral antidepressants take weeks and sometimes months before a depressed person may feel any relief. Traditional antidepressant drugs focus on different neurotransmitters. Ketamine appears to work immediately and relieve those suicidal thoughts in depressed patients. Ketamine produces feelings of relaxation, euphoria, and mental clarity. So let's talk about how ketamine affects the different regions of the brain. Studies on the effects of ketamine have revealed some amazing results. Through neural responses, it was found that in people suffering from depression, ketamine increased connectivity to more positive emotions, as well as improved communication between different regions of the brain, such as the prefrontal cortex or subcortex and the amygdala. Don't worry, these regions of the brain are associated with fear and anxiety. So here's a little anatomy lesson. The amygdala is a brain region that is responsible for our fear responses, and its activity often has ties linked to depression. However, the amygdala is more often linked with anxiety disorders such as PTSD. Doses of ketamine are helping to reduce key symptoms linked with mental health issues that can now be addressed through the introduction of this drug. So ketamine in treatment-resistant depression. Interesting results from a study on the effects of ketamine for treating depression showed that improvements in depressive symptoms correlate with an increased glucose metabolism and structural plasticity changes across several brain regions. Again, it's like the tree I talked about at spring. Everything's dead and then it starts to waken up, and they see that. Surprisingly, these findings suggest that not only is ketamine effective at improving anhedonia, the feelings of anhedonia, and that's just a big word that means emotional numbness or a person's inability to feel pleasure or joy. But since it also influences physical structure within the parts of the brain as well, this could pave new pathways forward when looking to treat depression long-term by using natural chemical responses in our bodies through medication rather than solely relying on behavioral therapy. So let's talk about how the doses of ketamine in high doses actually turns the brain off briefly. Unbelievable as it sounds, a team of researchers from the University of Cambridge have discovered that high doses of ketamine can briefly shut off brain activity. Examining sheep sedated by this drug, they noticed changes to their brain waves, which could explain why many out-of-body experiences have occurred, and people talk about this K-hole they hit, which is an utter state of oblivion. A professor, Jenny Morton, from the University of Cambridge, commented on her groundbreaking discovery. After the high dose of ketamine, we observed complete cessation in these animals' brains, something we've never seen before. Fortunately, though, within minutes, normal functioning was restored, essentially turning their minds back on again. This pause in neural function might be behind some truly psychedelic phenomenon experienced while we're under the influence of ketamine. Depending upon one's individual experience, The psychological outcomes may range from a psychedelic experience along with improvement in symptoms of depression and anxiety. All of these effects together give us a better understanding of this powerful substance's impact on our brains, and ultimately why so many are finding relief through its therapeutic benefits. And that's the key here. It has so many therapeutic benefits that we're finding out about. Ketamine is a powerful drug that has the potential to profoundly affect and alter brain activity. Despite our increasing knowledge of its medicinal value, research continues to uncover new mysteries about how ketamine operates in producing both a psychedelic experience as well as the beneficial benefits of taking the drug. As we continue studying this compound, there's no telling what other secrets it may reveal. Now let's talk more about treatment-resistant depression and how it resets the brain. I personally suffer from treatment-resistant depression. I have tried every antidepressant on the market. I have tried other drugs that are supposed to enhance the effects of those oral antidepressants. So I explored ketamine and learned about its treatment for mood disorders and antidepressant effects. I first learned of ketamine, the use of ketamine in the 1990s when I was working as a nurse liaison for the visiting nurses. I did an evaluation on a young woman that had developed chronic regional pain syndrome. At the time, there was a doctor in Philadelphia that was treating this horrific chronic pain condition in Europe by putting people in ketamine comas. This chronic pain condition is also called the suicide disease because so many lose hope as they live with this unrelenting and debilitating pain condition. Little did I know that in the future, my oldest son, Jeff, a Korean linguist in the military, in the Army, would develop this unrelenting and unforgiving pain syndrome. I was unsuccessful, although I tried really hard at advocating to have the military medical delivery system send my son to Europe for this life-altering treatment. Sadly, my son completed suicide 8 years after his diagnosis. He had been in Waco, VA Behavioral Health, and killed himself a day after discharge. I want to make you aware, we have 22 veterans a day that complete suicide, and it's been going on for decades. It was the doctors at the VA that pushed for this drug, ketamine, to get FDA approval. As ketamine becomes more mainstream with the growing industry, the Veterans Administration has approved this as a standard for treating many different psychiatric disorders that plague our soldiers and veterans. So if you have a veteran that suffers from PTSD, depression, or even drug addiction, or chronic pain, as my son Jeff did, taking ketamine or receiving ketamine treatments under the guidance of a medical professional may help them overcome their demons. I want to address the questions I get frequently asked on how dissociative drugs like ketamine cause psychedelic experiences while also causing improvements in depression. The use of ketamine is growing in the mental health field. It has come a long way from being a general anesthesia. Dissociative anesthetics such as ketamine are used to treat disorders like depression, anxiety, and addiction. But what is it really? Dissociation refers to a state of consciousness where you detach from your thoughts or feelings around your identity, similar in ways to a deep meditation. Many people describe the sensation connected with disassociation as very freeing and relaxing, providing them with a unique insight into themselves without judgment or control. So what does a treatment feel like? When you receive a ketamine treatment, you will feel the effects of it in a few minutes. Depending on the route of administration, the amount you absorb will impact your experience. And there are many ways to take ketamine. The platinum standard and the best route of administration for a mental health diagnosis for chronic pain is the intravenous injection. Of course, ketamine users can also seek relief from their symptoms via an intramuscular injection, a nasal spray, or even in the oral form. It's called a troche. And I'm told that the oral ketamine may taste like Drano. Not that I've ever tasted Drano, but I know that many compounding pharmacies are trying to make it more palatable for people. The effects of ketamine treatment can produce feelings of calmness and muscle relaxation. Many experience visual and sensory distortions. I have witnessed several patients, veterans, that sob and face the demons of war, death, and destruction. It's tragic to sit there and watch a big man be brought to tears as he's dealing with the demons from his experience in war. The hallucinogenic properties of ketamine can also cause a sense of detachment from the environment around you. As well, it enables you to be detached from your memories. And I want to make people aware that's why ketamine is working so much for our vets, because they have these awful memories of war and death and destruction that has gone against their values, their morals, because they were in following the rules of engagement of war. So they are traumatized. They're able to step back and be an observer of the incident that they had or the trauma they occurred versus being a participant. And it's just really amazing how it helps them deal with and resolve issues due to trauma. I have to tell you, with this detachment, it's not necessarily dangerous, but it should be monitored closely by medical professionals to ensure there aren't any adverse side effects or that they're minimized. The therapy process when taking ketamine should always include talk therapy. This is so patients can articulate their feelings after a ketamine infusion. Some work with a therapist via telemedicine during the session. Others visit their therapist within days of their treatment. I want you to know many find it hard to find the right words and express themselves during or even immediately after a session. This is completely normal. Ketamine has a half-life of 3 hours and works as both an anesthetic at high doses while supporting healing from mood disorders such as anxiety or depression when used in low doses. During treatment with low-dose ketamine, patients still may experience disassociation, which again is a sense of separation between the body and the mind. Ketamine also induces an almost complete sensory detachment from the environment around you. This process of disassociation can give patients the chance to reflect on their life experiences with greater clarity, allowing them to come up with new insights, how they want to live their lives while going forward. And that's something I have to tell you I've noticed when treating people that have had severe traumas while they're under ketamine. They, like I said before, are able to step back and observe what they did. And they are, when they're done with their session, able to discuss how they can come up with the new insights they developed. It's against their morals and values, some of the things that happened to them. And they are now able to figure out what they want to do to move forward. Some people that have expressed a feeling like a near-death experience. Some that have had ketamine treatments talk about the hallucinogenic properties have made them feel like it's caused them to have a spiritual awakening. It's not uncommon. As such, ketamine has been increasingly popular among mental health professionals as a tool to help people understand their problems and break free from long-standing patterns of behavior. Ketamine is changing the way we deal with our mental health. the use of ketamine has opened up an entirely new field of psychedelic psychiatry. And just for your information, I've created a whole series of ketamine and will make you aware of the benefits of psychedelic treatments as they become available to you. This has been brought to you by Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.